Well, good afternoon, everybody. Thank you for joining us. My name is Perry Newman, and I'm the Executive Director of Konbit Sante. I'm pleased to welcome you to today's webinar, When the Grid Fails, the Importance of Infrastructure in Providing Healthcare in Northern Haiti. Those of us who live or work in environments in which infrastructure, be it water or electricity or other structural essentials, are intermittent or unreliable, know that there are very basic essential challenges that have to be overcome or accommodated every day. When the work involves healthcare, however, the implications of unreliable infrastructure are far more serious. Our presentation today will feature individuals with expertise at the intersection of healthcare, Haiti, electrical engineering, and infrastructure, and I'm quite confident you'll find the discussion engaging and informative. Our presenters include Hugh Tozer, a longtime Konbit Sante volunteer, former chair of our board, and engineer, who has helped design and implement many of the electrical and water infrastructure improvements that support our partner facilities in Haiti. His work has focused on practical solutions that allow hospitals to continue operating despite unreliable power and fuel shortages. And Dr. Nelly Osias, who is the medical director of Serving Sante Hospital in Limbe and a dedicated OBGYN working to strengthen healthcare delivery in northern Haiti. She'll share firsthand perspectives on how reliable electricity and strong infrastructure directly impact patient care and the daily work of clinicians. We'll begin today's webinar with a presentation that touches briefly on Konbit Sante's work generally, and then drills down to the specific infrastructural challenges that we and our partners face daily. You can feel free to put any questions you have in the chat box, and we'll get to as many as we can following the more formal presentation. Again, thank you for your participation today, and let's get started with the presentation. So we'll begin with some definitional terms. A konbit, what is a konbit? We hear this term a lot, and of course it's in our name. A konbit is a Creole word, which means essentially a group of people working together for a common goal. It's a little bit like a collaborative, it's a cooperative effort. It's distinguished, in fact, by the fact that there's no identified chief, so to speak, who is directing things in a manner of superiority or superior position. It is very much a collective effort. And of course, Sante, French and a Creole word for good health. So the Konbit Sante is a collective working to improve health for the benefit and driven by the community. And our mission as an organization is to support the development of a sustainable health system to meet the needs of the Cap-Haitian community with maximum local direction and support. And without belaboring the point to too significant extent, each word in our mission statement or each keyword carries with it significant meaning that distinguishes our work. We're very interested in systemic improvements, sustainable improvements to the system that meet the needs of the community where we work. In other words, we're not all over Haiti, we're in the north, and with maximum local direction and support. And it is this maximum local direction and support that informs and defines our work. That's the Konbit aspect of our work. So a little bit of geography. In the inset to the left, you'll see the island of Hispaniola. On the east side, of course, is the Dominican Republic. On the west is Haiti in the sort of shape of an inverted C. We're just southeast of Cuba, to give you an idea of the ambient climate and so forth. Looking at the more detailed map, you can see that in the north of Haiti is the city of Cap-Haitian, which is where we work. In the center, if you like, of the crook of the inverted C is Port-au-Prince. This is a distance of about 110, 120 miles. Today, to travel there is both considered somewhat hazardous on account of the security situation, but also the roads are not good, and that drive can take 6 to 8 hours. So we're fortunate that we can fly in directly from Miami or Fort Lauderdale to Cap-Haitian and to the international airport there, which facilitates our work. And happily, at least at the moment, the security situation is much less fraught than in other parts of the country. That enables us to continue sustaining our work. Next one, please. Here we see some scenes from the community, kids, people going about their daily business. Transport is oftentimes on the back of the big trucks. And It's a very vibrant environment. And If you have the opportunity to be there on market days or when the kids go to school in their uniforms, it's energizing and uplifting. It's also a beautiful coastal community where, in happier times, in the port of Labadie, just to the west of Cap Haitian, it was quite a deluxe environment. Unfortunately, no U.S. carriers are flying into Cap Haitian, and the cruise boats are no longer stopping for a variety of reasons, all related to security. But it is a community of about 500,000, perhaps a little bit more, and a very vibrant community at that. Okay, next one. Okay, a little bit of additional geography, if you like. Zooming in further to the north, we'll see that, let me just make these thumbnail sketches go away. Excuse me. There we go. Okay. The pinned areas on this map as we zoom in on Cap Haitian here are partner organizations, partner clinics and hospitals that work with Konbit Sante. I hasten to point out that Konbit Sante does not own or operate any hospitals. All of the hospitals and clinics with which we work are locally directed, Haitian administered, Haitian run, with Haitian medical professionals doing the work. And again, that reflects the Konbit, if you like. Here, Justinian Hospital, underneath this pin in the furthest north, is the largest tertiary hospital in the north of Haiti. Our offices are physically located there. It's a very large teaching hospital with with a significant capacity of several hundred beds. We work there in the pediatric service primarily, and we've been there without interruption for 25 years. Also within the Cap Haitian area is another public clinic called Fort Saint Michel. That is a clinic where we have worked in partnership with the Ministry of Public Health to provide care to mothers and newborns and provide pre and post delivery care. That was a program run, as I should say, funded by a significant grant from the United States Agency for International Development. And back last January, I should say January of 25, when USAID funding was abruptly stopped, that program could have been entirely a casualty of the so-called wood chipper. But thanks to some very strong partnerships, very generous donors, and a lot of hard work, we were able to bring the capacity of our work at that clinic back from what was 0% to about 70% at this point. So we have a ways to go, but the work goes on. And we're very happy to see that children and mothers are being served at that clinic again in significant number. HHA is an abbreviation for Hope Health Action. It's a UK-based organization dedicated to healthcare in Haiti and other places around the world. We've partnered with HHA for many, many years, and with them we have arranged for an oxygen generator to be installed and operable, which serves our partner clinics. And more pertinent to today's discussion, here in the town of Limbe, which is about, as I said, about 10 miles, 12 miles from Cap Haitian, is Hospital Serving Sante, which is directed by Dr. Nelly Osias, from whom we'll hear a little bit later in the presentation. So that's the geography and the lay of the land, so to speak. Next one.
Good afternoon, everybody. So as we look at health care today, really what we find is that power is at the center of the infrastructure that's really essential to healthcare. And whether it is as the little icon on the top left, it's medical equipment or facility equipment. It could be cold storage for vaccines and blood storage. And without adequate storage of vaccines, you're unable to vaccinate populations and your health outcomes degrade. Water, for most of these facilities, they depend on pumped groundwater for their water supply. There isn't a municipal water supply in the Cap Haitian area. And so as a consequence, those pumps, they run on electrical power And then as you think about, actual medical care, you've got the medical instruments, sterilization of those, lights for operations exams. At the center of this, the hub, is a reliable and sustainable power supply. Unfortunately, in Cap-Haitian and frankly in much of the world, uh, power is a real problem at health facilities. This is some information from a very recent article in The Lancet. Uh, they reported that 1 billion people in low and middle income countries rely on health centers with inadequate power. And so the graph, that's 478 million health care facilities that have unreliable power. What they mean by that is they may have power outages during the course of the day. They may have insufficient power to run at night or to run all the equipment that they would like to run. Lots of different things come into play when they talk about unreliable power. Um, and then there are 433 million facilities that have no power at all. Our work in the Cap-Haitian area has seen firsthand some of the problems with an inadequate water supply, or excuse me, an inadequate electrical supply. Uh, it's dangerous to people, property, and equipment. On the top left there are a lot of neonates in the Justinian Hospital. They are on oxygen. They are on, in incubators to keep them warm. And if the power is lost in the middle of the night, their lives are at risk because nurses have to go in the dark to try to find them and remove tubes that are helping them breathe. So power affects them rather personally. There have been the loss of facilities at the Justinian Hospital alone. Electrical fires destroyed the urology department in the last couple of decades. There was a new cardiology department that was constructed, and before it saw its first patient, burned down. And then the housing for medical residents and their families, the salle privée, also burned down. A lot of medical equipment and computer equipment gets ruined by poor power. And buildings today are built with the idea of mechanical cooling. And frankly, without power and without the mechanical cooling, things can get too hot to work. There was a new pediatric ward that was constructed, I believe it was around 2018-19 was completion. And for the first several years, there was no air conditioning in the urgent care room. And the temperature we recorded in there was regularly over 90 degrees, which is just oppressive if you're trying to work. So why no municipal power? This is a city. If you look at the city itself, 500,000 people, but the surrounding area is approaching probably 1 million people even. And a lot of people have migrated from Port-au-Prince, where the situation is particularly bad. They've come to Cap, and it's a city that lacks a municipal power supply. Back when we first started working there, the utility power, which is from EDH or Electricity of Haiti, it had intermittent power. They had generators that produced power. There was no municipal power outside of the city center, and so people either relied on diesel generators or they lacked power entirely. Around 2013, 14, Venezuela came in with a new power plant and with subsidized fuel that provided a more consistent power supply for the city. Again, outside of the city, no power. People still relied on diesel generators, And around this time, we started to see more solar power in play. It was available even earlier than this, but this is really when we started to see it more throughout the city. A lot of people still no power. And then today, that power plant is no longer operational. Part of that is the just the fuel cost. We're seeing, because of current political situation, we're seeing high fuel prices. Um, Regularly, the fuel prices in Haiti are several dollars per gallon more than what we would pay here. Um, so there is no municipal power in or outside of the city. People are still relying on diesel generators when they can get fuel. There's an increased amount of solar power, and a lot of people who don't have that ability to generate their own power, they have battery powered equipment, battery powered lights that they charge up when they're in a place that they can charge them, and they bring them home, and that's what they're able, students are able to study by. So I think it's valuable to explore why health centers lack the power that they need for to support their work. This is a root cause analysis. It's using a fishbone diagram. And if you look at, if the question is why is there a lack of adequate power, there are four attributes that I think merit looking at. One is the power source, power distribution, and by that I mean the electrical wiring and the boxes and the like that bring the power from the source to the building. And then there's a secondary distribution within the building itself. Um, that's very much what we have in our houses. There's personnel and there's operation and maintenance. So if we look at these individually, there's inadequate power in part because the power supply is less than what is needed. And if you've done a fishbone diagram, the idea is then to ask, well, why is that? And, we've already talked about there's no utility power. So, but we can also say that there's insufficient generator power. And why is that? Well, in some cases, facility may not have the budget to buy a generator. Often it doesn't have the budget to buy the diesel fuel, and the generator itself might be out of service. In a proper fishbone diagram, you could take each one of these and keep on asking the why, the why, the why. In the interest of time, uh, we're not going to do that today. Um, so if we don't have generator power, why isn't there enough solar power? And some of the same issues come into play. System cost, maintenance of the system, and weather. There are times of the year where you're not going to get as much solar power, and you're not going to have the solar power that you need. And then last one is increasing demands. As climate change has had an impact. Building construction, as we mentioned before, it relies upon mechanical cooling. And then there are unplanned demands that come into play that suddenly there's a new X-ray machine and that just hadn't been anticipated at the time that somebody created the power supply. Distribution also contributes to an inadequate power supply. Some of that can be improper wiring, and that again can come down to cost or the training of the electricians. It can overloaded circuits can affect this. I've been in it was a neonate ward, a lot of incubators, and there was floor space, but there weren't circuits. There should have been a single circuit for each incubator, but instead, multiple incubators were on a single circuit. By the time you got to that last one, the voltage was so low that it wasn't keeping proper temperature for the child. Um, Inconsistent power needs. A lot of health facilities get donated equipment. That equipment isn't necessarily consistent with the voltage common in Haiti. And then the power source characteristic, what I mean by that is some power sources have a dirtier power supply, the voltage isn't well regulated, and that can contribute to problems. Personnel for the design, installation, operation, and maintenance. There is a limited training of electricians. The vocational training in the CAP area is limited. It often, just as it does here, the trades rely on people who, the master electricians there. But if they haven't learned well, or if they've had to rely on a lack of resources and come up with solutions around that, that continues or perpetuates those practices, which may not be ideal. Um, a big factor, and we'll look at this in a moment, is the management structure. And again, just like there may not be adequate training for some of the electricians, there's also a lot of facilities managers who are in that role but may not have the technical background to really support that role. There may not be, for the management of the system, there may not be adequate planning. There's often not communication about maintenance needs. And then there's also an over-reliance in a lot of facilities on outside resources. And that can lead to inconsistent support or uncoordinated efforts between different groups. And a lot of times groups focus in on projects that they are interested in, not on the planning portion. And I would say that one of the nice things about Konbit Sante is we have been there, we focus on the long-term relationships, and in that, you develop the trust with our partners so that we can be engaged in the planning and figuring out what approach is going to be effective for them. Last of the four we're going to look at that contribute to inadequate power is operation and maintenance of the system. And when you are in a resource poor area, you often you're not doing the preventive maintenance, but rather you're reacting to something that has broken down. And a lot of times that's because you just don't have the budget to do preventive maintenance, even though it might be in theory a good idea. Um, Often there's a lack of records, as I mentioned. A lot of equipment is donated and it lacks manuals, or the manuals are in a foreign language. Um, Record keeping can be a challenge. The availability of repair items. It may be that the item itself is not found locally, or the specialty technician isn't available. And at a root of this is also a lack of funds. So I think when you look at this, you see a lot of themes coming up: budget, planning, training, technical, and um, one of the things that uh, I think the UN Foundation and an organization known as Sustainability Energy for All, they've done a lot of looking at power supplies as well as other factors that affect um, life in lower resource countries. And this is a diagram that they put together in 2019 report. And I think it well aligns with that fishbone diagram. I actually put the fishbone diagram together first, and it was in reading this report that I thought this is saying the same thing, They identified three pillars of sustainable power supplies: organizational, getting the people together and understanding what the requirements of the system are, and then how to preserve that functionality. Technical, you making sure that the system that's installed is the right one for that environment. And then economic, having the financing and incentives there for the long-term operation and maintenance. And then each one of these three has to, there's an inception phase, there's a design phase, there's a construction phase, and there's an operation and maintenance phase. So with that in mind, I want to take a look at these three, the technical, the organizational, and the financial. And so I'm going to start with the technical because, I'm an engineer. I like technical, but I also see that this is often what people focus on when they say, okay, well, how can we solve the problem? We're going to solve it by technical. And there, as it said, the power supply needs to be robust and fit for the purpose. And the graph that you're looking at here compares solar power with battery backup or battery supply versus a diesel generator. And I think this is important because a lot of the health facilities, they have to have both of these. Um, if you consider the attribute of a power supply as can solar and batteries or can a diesel generator provide enough power, the quantity, well, yes, they can be. They can be sized to do that. And so they get the green, solid green circle to indicate excellent. Is the power quality between the two? Well, if you have a properly designed solar system, you can have excellent quality power. And a diesel generator, I would say, is generally good as long as it's maintained. It's not as typically as good quality as solar power. Can either of them be the sole source? I think with a lot of the facilities, the answer is no. And the reason is weather and cost, uh, availability of fuel. In terms of capital, solar systems tend to cost more initially than, say, the diesel generator. But in terms of operating costs, fuel costs right now is astronomical, and operating costs is just always been a problem with diesel generators, and it's even worse today. Maintenance is probably comparable between the two. Environmental, a solar system with batteries is awfully quiet, whereas a diesel generator is belching out fumes and it's very loud, and that can be a problem in a health center. Very briefly, in these are a couple of diagrams to show the different types of solar power systems. Um, I adapted them from the Revision Energy website. They are Revision Energy is up here in the Northeast and a great supplier of solar power systems. On the left, the solar system that's illustrated, you've got solar panels and there's an inverter. And the inverter takes, so the solar panels take the energy from the sun, they produce a direct current. The inverter takes that direct current and converts it to alternating current, which is what we have in our homes. If you're if it's a really sunny day and you're not using a lot of power at the house, any excess power goes off to the grid, and that grid is effectively your battery supplies. That's your backup power. And during the dead of winter, when your power demand might go up, the grid can feed that house along with the solar panels. It can feed that house when it needs more. So that's a grid tie system. In Haiti, it's a little bit more complex because we don't have an effective grid. And so instead, we have to have batteries. And this is one of the reasons why these systems can cost so much. Good quality lithium batteries are often, when we did an upgrade at the pediatric ward, the batteries alone, this was maybe 5 years ago, were $70,000. Um, you also have more components. You have a charge controller associated with it. You still have the inverter. And because solar power may not provide you enough, you have that backup generator. Another technical aspect to consider is the distribution. It needs to be designed, installed, and maintained to high quality standards, and I would argue international codes. The capacity of the system, it really has to take in consideration what are the current loads and what does the health facility plan to be doing in the future. Uh, what I've seen is health facilities do grow, but their electrical system may not initially anticipate that growth. And so that's one of the things that has to get considered. And one of the ways that we deal with that and the limitations on power is to have critical circuits and make sure that a backup power supply is there for circuits that are critical and additional circuits for less critical items, perhaps air conditioning. Those just don't get powered if there's not enough power. This is a great time to have a conversation with with the partners because when we were working with ULS and trying to figure out, okay, what would be critical, what wouldn't be critical, I suggested that the coffee maker might not be on the critical circuit, and I was quickly informed that no, coffee in the middle of the night is critical. So, it's one of those opportunities for discussion with your partners. Going back, getting away from the technical side is the organization and having the right people and systems in place to ensure the power is available. Personnel, you need trained electricians, you need trained facilities management, and you need people who can operate the system and who can maintain it. In terms of maintenance, the five criteria here are typical of a good maintenance program. You have documentation, you have resources, you have work processes, you have supervision, you have a maintenance program. And economic, all of these things require funds. They require funds for the design, for the construction, for the operation and maintenance. They need to support continued training of personnel, and they need to fund everything through the process from staffing and operation, preventive maintenance, and then anticipate that in the future, things do break, you're going to have to replace some things. So, briefly, a couple of slides to look at Konbit Sante's experience. Um, These are a few photos of work that we've done over the years at our partners' facilities, and everything from putting in a new grounding grid for the hospital, providing new electrical services to other utilities like the pumps. On the right-hand side, there are two different solar uh, systems, one for a pediatric ward and one for the ULS health center. Part of our work along the way has been to do electrical evaluations and work to find funding for improvements and work on the planning. I would love to say that we figured out everything from day one. We didn't. Um, we had a lot of lessons that we've learned along the way. Physical upgrades by themselves without an adequate management system. One of the biggest lessons, and I suppose we knew this in our heart, was that that's just not sustainable. this series of photographs, this is up at the top there, 2005, the radiology department at the Justinian Hospital had really some badly wired circuits. And so in 2005, Gary LeClaire and Mike O'Neill. Gary is a master electrician, and Mike is used to work for GE around the country and frankly around the world, repairing X-ray machinery, and put in a brand new panel, rewired everything. All was fine until there was a change that somebody decided needed to be made, and the electricians took the panel, they modified the wiring, and they basically returned it back to the state that it had been in 2005. And so this cycle is frustrating, it's expensive, and frankly, it's not sustainable. Things that we've learned along the way, projects can make improvements to utilities. Really, to be effective and to be more sustainable, you have to have long-term relationships with partners to grow that trust, to understand what their capacity for maintenance is, what their capacity for funding is, and engage in that planning and fundraising. As Perry had mentioned before, we don't run these facilities, so we do have limits in terms of our ability to control, and that's particularly true when it comes to the operation and maintenance of the systems. Uh, I think it takes time to figure out what the root causes are, and it that takes time and it takes patience on the part of the people who want to be engaged in a project and want to see improvements right away. And it takes a continued infusion of external resources, people and funds. There are, what we've been talking about is health centers who end up supplying their own power. There are alternative approaches to this. There are what I would characterized as a private utility. And in that particular case, the an organization builds and maintains and services the power plants, and then they charge customers for the energy that they use. And often, the one I'm familiar with most is they use solar power and batteries. They have well-trained electricians, and they do the in-house management. They also do the maintenance of the power supply, but they're not engaged in the distribution. They're not engaged in the design of the distribution system, and they're not engaged in the maintenance of the system. And that can be, as we've already seen, that can also be a problem. You can't just do maintenance of your power supply. You have to consider the distribution as well. There are questions about this when it comes to the sustainability. Private companies are not the same as government entities, and they may, what happens when that private company is no longer in business. And also with private utilities, there's only so many customers that they can support. If you get a chance, and at the very end of the slides, there's a reference to that Lancet article. In their evaluation of power for health centers, they conclude that it really is important that the government be engaged in ensuring there's adequate power. And so that is it. Now we get an opportunity to hear. I'm hoping that, yes, um, Dr. Nelly Osias um, is the director of hospital Serving Sante, and she will speak to her experiences at her facility. Take it away, Nelly, and let me know when you want to change slides.
Good afternoon, everyone. As you said, I'm Nelly, the medical director of Hospital Serving Sante. I personally thank people from Konbit Sante for all the work they are doing in Haiti, principally in the north of Haiti. I've been in touch with Konbit Sante since 2012 as a resident. They trained me. I was studying for OBGYN. I got good training with Konbit Sante, how to conduct research study. And I am very, very grateful and thankful for those ability I got from Konbit Sante to conduct research study. Talking about Serving Sante is a health facility and hospital located in the northern of Haiti, doing a lot of work with the community because this community is in real necessity and real needs. We got like 16 doctors, 20 nurses, and we have 3 residents. And every year the MSPP sent the Ministry of Health of Haiti send residents and they got training and with the hospital. Our challenges in the facility Serving Sante is like to have reliable power, like to have power 24/7 days. We don't have enough power. From time to time, we in blackout, we got out of power during the night, generally from 11 p.m. to 3 p.m. During the lapse of time, you will be out of power. And as you said, to get water, we're using electrical pumps. So if you don't have energy, you won't have power. You won't have water to be able to work properly as an hospital. You can see in the picture the localization of the hospital, and we have many services like the maternity doing an emergency cesarean because of the support of Konbit Sante, giving equipment, UIM, anesthesia machine, and so on. And we can see in the picture a baby in an isolate. Those kind of equipment, as you have heard, use a lot of energy, and those little baby, they will be in danger without power, without energy. And those are the kind of work you're doing, a part of other equipment using large of energy we are using at Serving Sante. We can go to the next slide. You can imagine having a critical patient in the OR and in the middle of the night, and generally those ladies for cesarean, emergency cesarean, they are coming in the middle of the night. And at this time, you receive this patient. There are like 2 patients, the lady and the baby, and you have no fuels, no energy. You are in complete darkness. The relatives of the patient, they are just waiting for you to help. Even you would like to do something to save this patient, the darkness reveals. You won't be able to do anything. Worse, the relative can become furious and violent, saying that you are responsible for this patient's life. And now you will be the one in danger. Against solar with batteries has improved healthcare at Hospital Serving Sante. Before we received the donation from Konbit Sante, we were using lamp soleil. Everyone knows in Haiti that the lamp soleil, it's a kind of lamp you use to get only light, and you won't be able to do anything with the lamp soleil vital things to save a patient life. You will be able only to see what you're doing. And if this lamp soleil is not charging enough, after a couple of minutes or a couple of hours, you will turn off, it will turn off, and you won't have any more light. So at this time, we were obliged to refer patient to Cape patient. It's like at 30 kilometers from Lembe, where the facility is working. And it's like not a long way to go, but for us in Haiti, because of infrastructures, the road is very bad. It's a long way. You could take like 30 minutes to get to Cape Haitian, to get another health center with energy. But because of our road, you will spend sometimes like 3 hours to get. And those patients in danger, sometimes they will lose their life. And other disadvantage using the T-Soleil, we have to use generator. And the generator, they are expensive and noisy. And we have patients, they have to be in a quiet place, but using the generator, you are putting like more stress on the patient. Now, today, because of Konbit Sante, we're able to use solar system with lithium batteries and diesel generator. We are using the diesel generator because our system cannot keep for a long time because got some problem in it. The solar reduce the hours of running the diesel generator. Very good for us in the facility. And the solar system capacity is less than needed. Is the reason we're using the generator, because we keep growing. More people are coming to get medical care because of where we are located. So as we are growing, we need more energy. And we have some problem with the maintenance of the solar equipment. Is the reason why Konbit Sante is working to see how they can improve and reduce those problems we are having. And Serving Sante, we still need generator because of the limits of our solar system and the large equipment donated we are using to take care of the patient. Like in the OR, we got anesthesia machine, and we got for the neonatology NICU, CPAP, incubators, and we got warmers to keep the babies alive. So we still need more power. And for radiology, we got an X-ray machine, an IMX4, and a CR Fuji machine using large energy. Because of those equipment, we have from time to time to turn on the generator to keep working. And with critical patients and need for oxygen, we need to use like oxygen concentrators. For this equipment, we need to use the generator. And for conditioning, for our room, for ultrasound, for X-ray machine, for the neonatology, and principally for the OR, we need to use the conditioning. And anytime we need to get surgery for a patient, we have to put on the generator. A good solar system improves healthcare, and this is everywhere. It's principally where we are working. If we have good solar system, good energy and light, we will save more lives and we will have better outcomes. And our community, the people we deserve, we are serving, they will be confident. Because if those people come and they already know that they will be out of power and doing a surgical intervention, they will have no power and they will be in danger. The relative, they will be in danger. Those people won't come. And those days, Serving Sante in the community is the only one giving service for surgery for those critical patients. And they are obliged to come even though they know that they will be in the darkness. So having the solar system working very well, we will get more life saves and more confidence from the relative and the patient. And the solar system, if we have a solar system, this will minimizes the need for generator power. We will saving on fuels and using the fuels and the generator, we spend a lot percentage of the income of the facility to buy fuels. So if we have solar, we will get this amount of money to use it to have more clinician and then to reduce our staff burnout because they got overworked because you cannot pay a lot of clinician to take care of them. And having a good solar system, this will reduce the noises, the stress, and obviously this will reduce the air pollution and reduce some disease like cancer, like disease we got from air pollution. And we thank huge all the people from Konbit Sante for the support they are giving to people in Haiti, in Cape, all those facilities you're supporting. And thank you to all of us. Thank you.
Thank you so much, Nelly, for the presentation. I told people, of course, to hold your questions to the end, and apparently I overpromised in terms of the time that we'd have left, but we're certainly prepared to stay on. And if folks have any questions regarding what you've heard in the presentation or any other aspect about Konbit Sante's work or Serving Sante's work, we'd be very happy to entertain those now. While we're waiting for the questions to pop up in the chat or otherwise, I would just say that, and this is something that Hugh touched on, as well as Nelly, is that it's the management and the maintenance and the planning that really is sort of the DNA of the sort of the secret sauce that Konbit Sante seeks to impart in our work, sending down equipment and sending down materials and building out a beautiful facility is only valuable if it can be sustainable. And the planning that is necessary to keep something in operation, even something as simple as Hugh said, the training manuals that oftentimes don't accompany equipment can make the difference between an operational piece of equipment and something that becomes a very, very large paperweight, to put it bluntly. So I would also recommend to you that you take a look at this article that was referenced to in the presentation. And now we'll take a look at some questions that we have popping up here. First question has to do with elaborating on the training for maintenance needs. And the second question is, does Konbit Sante provide capacity for building and training on solar photovoltaic systems for local electricians and technicians? Let's take, if I may, Fran, I'm going to take the second question first, which has to do with the training. This has been an ongoing challenge. for Konbit Sante. And I know our country director, Tetsuya Noguchi, is on the call, and Hugh has some experience trying to find and to teach training for those who would maintain the equipment. And I know there are others on this call that have as well. So can I toss it out to, in the first instance, Hugh, to see if you can talk a little bit about the challenges of training and getting local talent to do the work?
Sure. It's a great question, and it's one that we've explored because it's not just for the solar system and the maintenance of the solar system, but rather electrical installations uh, as a whole. And we have worked with some individuals, but we have not yet found a way to, start a vocational program or to become part of a local vocational program, but rather have done it more on a project by project basis. And we've worked more recently in the last several years with groups. Justice Energy is one of them where they have a local team and they have focused on doing um, their own internal training. That's, I would say, has mixed success at this point.
Great, thank you. And I know we work with other of our partners to try to set up training programs. And it is challenging for a variety of reasons, not only because the reality of the situation in Haiti is that it has been, at least up until the past year, I would say, it has been the case that when people have the opportunity to leave Haiti for a better position for their family, sometimes in the States when that was possible, there was a bit of a hollowing out of the professional pool. So there are a number of challenges that contribute to this. One question that I can address very quickly is that do we have a relationship with the health ministries and so forth, the MSPP? And in fact, we do. It is our longstanding relationship with the MSPP and various other agencies of the bureaucracy that enable us to bring products into the port um, and to see that our community health workers are certified and that our work is approved and permitted to go forward. So without a long-term relationship of trust and confidence, we would be unable to do what we do, and we're very fortunate to enjoy that. We also had a question here it is from Mike Chonko regarding lithium ion batteries. And again, this is a question for Hugh. Have other methods of energy storage been considered, especially for thermal storage for night? And is the diesel generator being used in combined heat and power configurations? Back to you, Hugh, if you can.
Yeah. So we have tried other battery types. When we first started, we were using the Trojan T105s, the lead acid batteries, and then AGM, and now it's the lithium. We haven't looked at alternative ways of storing it, and we haven't done combined heat and power. Um, and partly we're not needing that heat, uh, but uh, but we haven't done that. No, I would say this. I would encourage, and I realize that I've got a typo in the uh, the websites. I transposed B and I. My apologies. Uh, but I would encourage if you have some thoughts about how one might store power alternatively, or if training programs that um, you might have a suggestion on how that could work. I'm certainly willing and eager to hear from you. I am not a solar expert. Um, like a lot of things, you you become necessity is the mother of invention. You become somewhat qualified. But there are people, I suspect, on this call this is their business, and I would love to hear from you about alternative ideas.
That's probably as good an opportunity as any in the Department of maintaining communications. Please do feel free to reach out to Konbit Sante. If you send it to info@konbitsante.org, we'll either handle the question right away ourselves with our staff, or certainly reach out to volunteers who have been so critical to Konbit Sante's success. I will say that Konbit Sante is celebrating our 25th year, 25 years of continued and uninterrupted service to the community. It's been an extremely rewarding and challenging and deeply meaningful um, uh, 2 decades and a half, all of it powered by local expertise, local commitment, and an extraordinary community of volunteers that make the work not only effective but highly rewarding. So I want to thank everybody for joining the webinar this morning, particularly thank um, our presenters, Hugh Tozer and Dr. Nelly Osias. A recording of this presentation will be made available very shortly, and we will obviously the slides will be part of that as well. And so we thank you for joining us, and thank you for your support of Konbit Sante. And all of us are very happy to be working alongside you in trying to improve the healthcare system in Northern Haiti. Thank you so much for your time today.